Okay, thank you for joining me this evening for the 2014 Programs for Better Living Policies and Procedures update. As the Arthritis Foundation continues to grow and try to enhance our physical activity programs, we realize that there has to be some changes made in our policies and procedures. These changes will remove some of the barriers. However, they are not changing the actual program components, even though it may feel like it in some senses. The new policies and procedures will take effect starting January 1st, 2014. These changes have come down from our national office, so this is not a regional transition. This is a national transition that will be enforced January 1st, 2014. Today, or this evening, we're going to discuss several of the changes that have occurred with the policies and procedures section. And I think we have on the line of myself, Jasmine McKay, the Heartland Regional Program Director. And we also have Brooke Burns, who is our program coordinator in Kansas City, Debbie Cooper, who is one of our seasoned trainers, as well as Tony Morgenstein, another one of our seasoned trainers. So I'm going to go ahead and get started. Let's go here. So this evening, we're going to talk about what these new policies and procedures are, how the Heartland region plans to roll them out, discuss some of the transitional things that are going to happen, and talk about some of the frequently asked questions, documents that we may need to create or may need to get from our national office. At the end, we will discuss any questions or comments that you have for me that I might be able to answer right away, or things that I might need to follow up with our national office too. The plan is to talk with all the trainers, or as many as we can beforehand. So this webinar is being recorded and will be shared with anyone who was not able to participate in the today or yesterday. Get as many questions answered and concerns addressed as we can. We do understand that there are some things that everyone may not agree with, and we are trying to figure out a happy medium to make it work. So what are these new policies and procedures? The co-sponsorship agreement, the general liability, the certification process, we have a new online training, recertification, and the participant release forms. Let's start with the co-sponsorship agreement. The co-sponsorship agreement, which was previously required for all facilities to complete, anyone coming to a training workshop had to complete this form, is now optional. This will help some people before they come to the trainings and they don't necessarily have a site, or their site doesn't want to sign the co-sponsorship agreement. This will eliminate that barrier and allow us to train more instructors and potentially reach more facilities that weren't really comfortable with filling out that form. This also reduces the accountability of the facility, the Arthritis Foundation, and it shifts it over to the instructor. So the instructor will now deal with the liability while teaching the class. Goes right into general liability. So as an instructor, you have two options. As a trainer, while you are doing training workshops, you're still covered under our insurance. But as an instructor, while you're teaching classes, you will need to be covered either by the facility where you are employed or have your own general liability insurance. The type of insurance is aggregate single occurrence limit, not less than $1 million for personal injury or property damage. Many instructors do have coverage through their facilities. There are some instances where facilities do not cover their instructors. Those instructors will need to go out and pay for their insurance. And I'll discuss a little bit later one of the frequently asked questions documents that we'll create to help instructors figure out how to do this. The certification process. The certification process will now be shortened. So one of those things where we had people that had previously had to teach a series of 6 classes prior to receiving their certificate has now been eliminated. Instructors will now be certified and leaders as soon as they complete the training workshops. They will receive their certificate. They are no longer required to teach the 6 classes. This is putting the exercise and aquatic program in line with the Tai Chi certification, as well as how our online exercise training is structured. So with the online training workshop, it is a two-version option. This program is being offered in combination with AFA, the Aerobics and Fitness Association of America, AVA actually runs the online training workshop. They're in charge of everything. So if anyone has any issues, problems, or needs to troubleshoot, they go directly to AVA. The training is $129. It covers the workshop, a downloadable manual, 2-year arthritis certification, and a 1-year AFA membership. The two options, if someone is interested in doing this training, are to do a live training or an on-demand training. The live training will be held at least once a month through our national office. And this is a 6-hour training where someone stays at their computer for 6 hours to complete this workshop. The on-demand training is offered 24/7, 365 days of the year, which allows someone to complete the training workshop whenever they're able and willing to do. They have up until a year to actually complete the training workshop. Now, although we have the online version of the exercise training, we will still be offering in-person exercise training workshops in most of our areas. We do have a couple of areas where there is not an in-person exercise trainer, and we will work on that in 2014, but we will be still offering it. We won't just go directly to online for everywhere. So now that the certification process has changed and the liability has changed, it's more important than ever to make sure the candidates that we train in our workshops are fully prepared when they leave. It's very important to make sure that they clearly understand and correctly demonstrate the exercises, because they're now certified when they walk out the door. There's no 6 classes for them to work out the kinks and kind of get a feel and understanding for it. They are certified when they walked out the door. With that being said, we're going to need to set up some requirements and some objectives for them to need to complete in order to say that they are fully certified. These objectives include completing the workshop, the entire workshop. There's no arriving late. There's no leaving early. If that's the case, then they do not get their certificate. They need to successfully teach back their exercise demos, including correct demonstration, discussing any precautions, having good voice projection, etc. They also need to pass the post-test and make sure that they stick to the book while they're doing their teach back. These are going to be all really important components at the training workshop, again, because of not having the 6-class training requirement that we previously had. Recertification has changed. Recertification will now be required every 2 years for all programs. This is similar to other certifications such as CPR, some of the basic water rescue. We are now aligning ourselves to other organizations and also to our Tai Chi program. Our Tai Chi program has had a 2-year certification for the last 3 years, I believe. Participant release forms. They are no longer required to use the AF version. So facilities, if you have your own version of a release form, that is A-OK. You can use that version. You do not have to use the Arthritis Foundation version. Leaders and instructors will be responsible for ensuring that their participants sign these forms. It's no longer going to be the AF harassing you to collect these forms. It's really going to be up to the leader and the instructor. And based on some of the general liability insurances that instructors will be using, they will be required to collect these forms and maintain them, I believe, for like 7 years. It may vary depending on insurance. One key thing to note is page 2 of the participant release form has been revised. It includes basic standard language, so it covers all Arthritis Foundation programs and special events. It's not just program specific like it has been in the past. The program information form, also known as the attendance form, is still important, and that has not changed. We will still need this information. It will now be extremely important to help us track classes, class locations, so we can update our website. It'll also help in certain areas where we do have received state funding and United Way funding, so we also need to know and provide those numbers. And even in areas where we don't have funding, if we're trying to show that these programs are extremely important, that they help the community, we need to show with numbers. The prevalence of arthritis has increased. It went from being 50 million to over 52 million. So we need to show that we have impact with these programs. And one of the ways we can do this is by submitting these attendance forms quarterly or yearly and showing that here are what this many people are doing to help improve their arthritis. The one change for this form is they will no longer be mailed to the local offices. All data collection will be mailed to the Public Health Reporting and Outcomes Coordinator housed out of our regional office in Chicago. So with all of these changes, and I won't say we haven't had a lot of time to adjust to them, so there's going to be a little bit of transition. We learned a lot from when we made the regional change and extending the certification and trying to combine the research and the full. So we learned a lot from that. And while we're in this transition, we do expect there to be a few glitches, but we're trying to make sure we limit that. How we plan to limit that is by having constant and consistent communication. We're starting with the trainers, you all at the top level, because you all are in the field, you're out there, you're our go-to volunteers. You do this on a regular basis. You know more about this than a lot of the staff people who are not out there or who are brand new. So we're starting with communicating the changes to you, getting your feedback, going back to our national office, seeing what we can change, what we can't change, and then following back up with you and moving forward. The next level will be to talk with our leaders and instructors and the facilities. So the plan will be to, starting in January, we're going to be sending out a letter through the mail to all of the leaders and instructors to let them know about the changes that are occurring. We'll also send them out to the facility. We will also put in the e-newsletter that comes out quarterly to let everyone know about all the changes, as well as put it on our website and offer a webinar for the leaders, instructors, and the facilities as well. So as I mentioned, the communication will be in our e-newsletters, it'll be a mailing, it'll be webinars, and in some instances, even phone calls. So we want to really, really make sure that everyone clearly understands what these new policies and procedures mean and how it affects them. Next update. I know I mentioned that the recertification is now every 2 years, so that means every 2 years there should be some type of update. I hope so. I'm not really sure. I do know that there are tentative plans to update both aquatic and exercise programs within the next 1 to 3 years, pending funding through our national office. The policies and the logistics sections of all of the leader and the instructor and the trainer's manuals will be updated. I do not have a date yet, but I know that they will be updated. And as soon as I receive the updated version of them, I will make sure that every single trainer gets the new version. 2014 trainings. We are in the process of planning, if not having finished plans, all of the trainings for 2014. Registration options will still be the same. You can do online registration for all of our classes, or you can register by mail, which should be mailed directly to the lockbox. Excuse me. If you happen to register for the online exercise training that actually does not go through the AF, it goes through the AFA website, in which after someone's registered and completed that training workshop, the local person does get that person's contact information. So we will know who's actually signing up for these trainings. For training materials, at the beginning of the year, once the new training guide comes out, all of the trainers, you will receive a sample bag of what will come in the training bags at your training workshops, the new trainer guide that has the new policies and logistics section in there, and a couple of checkoff sheets to help you. Prior to training workshops, the trainer at their home will receive the certificates, the continuing education units, the training rosters, and a checkoff sheet for that training. At the facility, there will be 2 boxes the day of the training. There will be 1 box from the Office Max, which will have binders in it, and then the other box will have the bag and the folders for the actual instructors and leaders at the training. So, frequently asked questions documents. I referred to this a little bit earlier. A lot of times people have questions about the certification process, so we'll probably create a 1-pager to help people go through that. The attendance sheets, how to fill them out, how frequently, have a frequently asked questions document for that. Our national office is actually working on a liability insurance document, a how-to for our leaders and instructors. Excuse me. Suggestions on where to go to get liability insurance, what's the process. If you go through your facility, how do you do that? What does that mean? To make sure that this transition is as easy as possible for them. And there's already a created document for how to do the online training. There was also a suggestion based from our last call that we create a cheat sheet for our instructors. And this cheat sheet would involve letting them know what they need to be responsible for, including the participant release forms, dealing with the general liability, and also dealing with any other issues that come up day of, whether it's their certification, how to do online, whatever. Excuse me. Questions, comments, anything you give me now, I will email over to my national office and get back to you as soon as possible. Debbie, Tony, any questions, feedback, any issues you see may happen, concerns?
It will be nice to have the paperwork ahead of time so we can review that, so we can sound at least confident when we present this new material, especially for those that are coming in for recertification.
Okay, well, the actual material will be the same except for the one section. Right. And similar to how we did before, I'll create the one-pager cheat sheet for the logistics so that you can kind of skim through it. For the research, it will be an adjustment for them. The people who are currently certified in 2013, they are grandfathered in, so they won't have to worry about these changes, but anyone getting recertified in 2014 will.
Okay.
So yeah, as soon as I have it, I will get it out.
Perfect.
Anything else you might have thought of? Anything we didn't think of? Any gap areas where you see something could be an issue?
I don't at this point.
Okay. I just want to make sure I've answered anything or that it's clear to you pretty much. And if there is an issue or anything, you can contact myself or whoever your local director or coordinator is, and they will get back to you as soon as they get an answer. Again, this is a transition, so I do realize that as we're going thinking about it, stuff will pop up. I will share the questions that were asked yesterday with everyone as well, so that everyone kind of gets a feel, because you may see someone else's question like, oh, I didn't think of that. Well, what about this?
Okay.
All right. Well, if there is nothing else, I'm not going to hold anyone. Thank you for joining the webinar this evening, and have a good night.
Thank you.
All right.